Welcome back to the workshop on lessons learned from the COVID pandemic to improve diagnosis. I'm Kosli Simon, Herman Wells Professor at Indiana University and the Associate Vice Provost for Health Sciences for our campus. I am joined by my co-moderator, Dr. Suzanne Bakken, who is the Alumni Professor of Nursing and Professor of Bioinformatics at Columbia University. We are so pleased to moderate this session on diagnosis and public health responsibility. So this is the part of the workshop we're diving into the role of the public. And the public here includes government agencies that set guidelines on information, on what's covered, by example. We are just learning now about what insurance coverage of home COVID tests will mean. That's an example of something that wouldn't have happened without public sector intervention. The public also includes social media. A Pew Research Center survey from the end of last year showed that about half of the US say that social media is an important way of following COVID-19 news. So it's an essential way by which we keep people informed and connected on diagnoses. We were reminded at the start of the workshop by Dr. Yang that on how the public is now more knowledgeable about reading results of diagnostic tests and concepts like false positives. But social media can also spread misinformation, which has a viral nature of its own. So there's a lot for us to delve into here. In this session, we'll be hearing from three speakers. First, Dr. Raina Merchant, a Penn Medicine Associate Vice President of Digital Health and a tenured professor of emergency medicine at the University of Pennsylvania, will discuss the role of social media in affecting individuals' decisions to get tested and public actors' efforts to influence the decision. Next, Dr. J. Mark Overhay, Chief Health Information Officer at Anthem, Inc., will discuss the role of public health infrastructure in identifying the emergence and community spread of disease. Finally, Dr. Martin McKee, Professor of European Public Health and Medical Director at the London School of Hygiene and Tropical Medicine, will describe lessons learned from bringing the public health model to diagnosis in the United Kingdom. Just as a reminder, the longer bios are available on the website workshop. And after the three presentations, we'll begin a panel discussion during which we encourage your involvement in the workshop by using the chat box on our website to ask questions or make comments to be addressed at that time. And with that, we will start with Dr. Merchant's presentation.
Thank you so much for the introduction and the invitation to join this esteemed panel. I'm really excited to join the group today and to delve a bit more into the role of social media, as you mentioned, digital data and diagnosis in this pandemic. Next slide, please. This slide includes my current funding sources. I have and PI on 2 R01s from NIH. I have a mentoring K24 from NHLBI, and R21 and a foundation grant. There are no disclosures relative to these grants, what I'm going to discuss today. Next slide. At Penn Medicine, I direct our Center for Digital Health, where we focus on data mining and how we can learn insights from that to inform our digital engagement with patients. And then importantly, digital equity and access. On the next slide, really our work here is across multiple different sort of platforms, but really that's why we have been engaged in this space. This is an article by Bud et al. That really shows the ways in which digital technologies have been important through multiple phases of this pandemic, from the use of smartphones and apps and wearables, sensors, social media, data dashboards, et cetera. I'm not going to touch on all of these, but just wanted to acknowledge that there really is a wide network here of different sources. On the next slide it is really that we've learned through all of the information that is available from these digital data sources that they are creating or enabling an incredible amount of information. And the WHO has deemed this an infodemic, and that really the incredible volume of all of this data and the reach of this information has contributed to how inaccurate information about many aspects of the pandemic has been shared in terms of rumors and fears, and it makes it very difficult for the public to learn essential information about an issue such as diagnosis. On the next slide, my colleague, Dr. Nicole Lurie, and I have been writing about the evolving role of these platforms in public health emergencies and really the opportunities and challenges. We wrote about this almost 10 years ago in terms of social media and emergency preparedness, and again in 2020 to update to talk about how much had changed over the past decade and how we should think about these new sources during the midst of COVID. On the next slide, I'm going to go through a couple of areas in which, a couple of ways in which these digital platforms have been used to inform public sentiment, reaction, and how the public is thinking about diagnoses. On the next slide, I'm going to start with tracking symptoms and public sentiment. Our team built a map on Twitter early on in the pandemic, about 2 to 3 weeks after the COVID-19 pandemic was officially named. And here we pulled several millions of tweets every day about COVID to really track sort of mental health and expressions of loneliness, depression, anxiety as it unfolded across the pandemic. We looked at what people were talking about by region and the variability and how there are these geographic boundaries and how people talked about things like diagnoses, about the questions that they had. We also tracked the top symptoms and were able to observe that people started posting early about symptoms that they were attributing to COVID before those were acknowledged as being officially connected with the disease. And so identifying just this really way in which you can do a lot of surveillance early on to identify new things about a disease using these different methodologies. And then finally, we looked across regions at differences in engagement and sentiment about the pandemic, demonstrating just a new way in which we can use these tools for tracking things about the questions the public has about how to get diagnosed, where to get diagnosed, how to interpret the results. On the next slide is a map of, or are some word clouds showing information that we looked at using the platform Reddit, where here we were trying to understand how people talked about their experiences with COVID and particularly long hauler symptoms and the things that were associated positively and really the things on the right that were associated more negatively, showing again that we could use these platforms for identifying as sort of sensors from the public about their experiences with COVID that would impact decisions that they might make about getting tested or where to get tested. On the next slide, I'll transition to sort of ways in which these digital platforms have been used for tracking disease. If you move to the next slide. This is an early example of how you could use metadata from an individual's cell phone. And here they looked at pictures that were posted on Instagram very early on in the pandemic. And they could track movement of individuals across regions just based on the latitude, longitude coordinates in the pictures that people took to see spread of disease. Again, demonstrating just the potential for these platforms in being able to play a role in surveillance or in spread of information that happens through these devices. Moving to the next slide. This is an example also using smart thermometers where there were maps that were generated from these smart thermometers to demonstrate potential areas of increased influenza-like illness just based on how many people were reporting or identifying elevated temperatures using sort of these connected devices as a way for people to then be able to think about their risk and their willingness to get tested or not based on information collected remotely from these sensors. On the next slide, I'm going to talk about sort of the really important role that was mentioned at the start of this session about how all of these platforms can also be a source for propagating misinformation. And on the next slide, really we've seen this throughout every aspect of the pandemic, and that there are many approaches for addressing it, but really there's a need to evaluate the effectiveness of these various approaches to really make a dent in this misinformation crisis. Next slide. And this is really, I like this work by Sanelli et al. Showing that if you just had a targeted strategy for one platform, you would need to have different strategies across platforms because the ways in which people communicate varies rather significantly. Next slide. This is some work that our group did on TikTok, another platform, demonstrating that about a third of the information posted about the COVID pandemic was misleading or incomplete. And this came in various forms, again, showing that if people are turning to these sources for diagnosis, that there will be a mix in the types of information that's accessible. Next slide. And then in tracking movement, next slide, thinking about different ways in which these platforms can provide information about risk around you. This was a screenshot from OpenTable. And so trying to get a sense of how many people were booking new reservations for restaurants gives you a sense of your risk and whether or not you may want to think about symptoms that you have and the prevalence of a disease in your particular area. Next slide. And in tracking risks, next slide, there's a lot of work looking at digital contact tracing and how there have been a lot of apps which have emerged that give people a sense about their own test and then the test results potentially of those around them or in their proximity that can influence the decisions people make about their behaviors or willingness to get tested. Next slide. And then transition to public health messaging, and next slide, and how we think about really needing precision messaging. This is some work we did in vaccine, published in Vaccine, that if we really want to communicate effectively to the public about their risk, about the pandemic and their need for testing and how to interpret, that we need more targeted approaches. So here we looked at posts about vaccine and how they varied significantly by region and by different groups, and that that we need approaches that allow for information that can change rapidly and be responsive to the needs of the public. And then next slide, I believe this is my final slide, tying this into the presentation we just heard from an excellent discussion from the speakers around equity, that in thinking about this more precision-based approaches for public health, that needing an equity lens to really think about different ways of partnering with groups and how we should think about more tailored messaging that curbs through both digital and non-digital sources. So the next slide is just a thank you so much, and I look forward to hearing from the other speakers and the discussion in the panel.